So the Massachusetts General Hospital Cancer Center established a cancer care program on the islands about 2.5 years ago. And about 3 years ago, we were talking about how that would roll out, what sort of what could work well and safely, given the constraints of sort of island life, and being off mainland does make some challenges like blood transfusions and delivering chemotherapy and things. And the goal was to deliver world-class local care, to have a real connection to the expertise in Boston, but for that to be available on your doorstep. And so we have a team of 7 people who come to the island. Actually, one of our clinicians now lives on Martha's Vineyard, one of the perks, and do a clinic. So on Martha's Vineyard we have one MD a week and a nurse practitioner who's here Wednesday through Friday. So now we're very pleased with our team, and so we cover all specialties. And there's particular specialties, like, for example, Dr. Barnes is a real lymphoma expert, or Dr. Shapiro is a real breast cancer expert. And so it's nice to have their expertise. Generally, we have a specific, what we call site-specific pancreas, ovary, whatever sort of cancer, as a site specialist and an islands oncologist. So patients down here would have their primary care doctor, often is sort of very invested in the care of their patient, an island oncologist, and maybe a specialist oncologist as well. So what's a typical patient's experience? So we have a coordinator, Karen Kazanjian, who for new patients will make sure that we have all of the necessary details: recent clinic notes, scan results, operative reports, pathology reports, and anything relevant. We're moving into a new era where as much we're interested in the mutational analysis of cancer as we are in what a pathologist says. And a patient would meet India Rose, who's our coordinator, who would arrange their visit, would arrange scans and blood tests afterwards as well. And we have a lovely lady, Sonia, who sits on the desk. So there is sort of a friendly face to a sort of a state-of-the-art team in terms of delivering cancer care. And a typical first visit would be meeting with the oncologist, going through the information over an hour or so, making sure that we had the story correct, understood things, both from a sort of medical model of getting all of the details and a personal model. We pride ourselves on delivering state-of-the-art care, but with a personal connection. I think we really want to ensure that the team is here for the patient's chemotherapy and for the patient. Cancer care is increasingly a multi-leveled, multi-person, multidisciplined sort of approach to get the best outcomes for patients. Most commonly, people go through 4 to 6 months of the sort of immediate treatment, and then it's follow-up. And we typically in the first 2 years would see patients every 3 months, again, without having to go up to Boston, being seen at Martha's Vineyard Hospital. So if you're getting treatment for cancer at Martha's Vineyard Hospital with the team here, we want you to know that you're getting the very best of chemotherapy, and so hope builds that you're going to get a better outcome from getting state-of-the-art care. So imagine recently diagnosed with a serious illness, and you have to trip up into town to meet new faces and go through all of the informational, personal crisis of being diagnosed with cancer. Bad news, a new experience, the whole sort of frame of reference of your life is turned upside down. You become a patient, you sort of enter this complex world of illness. What we're able to do with the Cancer Center here at Martha's Vineyard is make that something that can happen at home. So you have all of family, friends, community there to support you through a difficult time. It enables us to give care with patients here getting the very best of support. Making sure they get emotional support, just the people who love you around you, supporting you through a difficult time. And really being clear on a plan that you can walk down the street, you can climb in the car and get to. You don't have to travel up to Boston to get treatment. So again, world-class care at your doorstep really enables all of the cancer care to be delivered in an environment where you have all of the support of your community.